afternoon, everybody. I'm Jody Hanson. I'm Director of Public Affairs and Communication for Johnson County Government. Thanks for joining us for today's Facebook Live event to talk about vaccination rollout in Johnson County. I have with me today Dr. Sami Ariola, who's the Director of Johnson County Department of Health and Environment. We also have Deputy County Manager Maury Thompson with us today, who's going to talk about some of the resources available here in Johnson County due to the cold temperatures that are here and continuing throughout the weekend. We thought that was an important topic to incorporate today. So let's start with Dr. Ariola. If you could give us kind of a wrap up of the week and a look ahead to next week in terms of vaccinations.
Thank you, Jody, and good afternoon, everyone. I'm Dr. Ariola with the Department of Health and Environment. This has been a very busy week. We focused a lot on giving out second doses. Today, at our clinic at Arts and Heritage, we vaccinated over 1,700 people, precisely 1,760. And that brings the weekly total vaccination given, first and second doses, are slightly over 7,000 for the week. Of course, that's very intense with clinics running in 2 locations on Wednesdays and Thursdays, and Thursday. And that's essentially the goal for the week is to ensure that those that are due their second doses get it. Next week would mimic what we see. Next week, we have slightly over 6,000 of our residents 80 plus that are due their second dose. And so yesterday we sent out the link for them to register. And last I checked with staff, virtually all of them have booked one spot or another, and all of the spots have been taken up. And so we're ready to do the vaccination next week for all of our 80 plus that are due their second dose. Again, like we've said over and over again, we have your second dose. And as we are giving a second dose and a first dose in the 80 plus category as much as we can, our partners in our health systems, St. Luke's, Menora, Overland Park Regional, Advent Health, Olathe Health, and KU are vaccinating in the 65 plus category. And we all of them have received shipments of vaccines this week. Again, the big ones got just slightly over 2,000 doses. It's not a whole lot of vaccine, but like we said, every little bit helps. We are chipping away. And I know that they are opening up clinics and they are vaccinating in that age group also. And we are also working on sending out invitations to everyone who is 80 plus, who has completed our online survey, and to book an appointment to be vaccinated. We really do want to open that up for everyone. Now that will go on over a period of days, perhaps weeks, but those appointments are coming and they will be exclusive to those who are 80 plus, as our partners are vaccinating in the 65 plus category. So pretty excited about what we have in the works the next 2 to 3 weeks in terms of ensuring that our most vulnerable population gets the vaccine into their arms. Now, next week, just like we saw this week, there's a few of you because of the weather who canceled and rebooked their appointment. Very important because of the weather, and I know that Maury will be talking about that very soon. The forecast is going to be pretty harsh on next week. And so safety first. If it is not convenient for you to come, please feel free to cancel your appointment, reach back out to us so that we can rebook you on a time that that's more convenient for you. But as we cannot overemphasize the need for safety first. Now, at our clinics next week, we'll have abundant staff available to assist. We'll have warm buses. We'll have buses that are driving around and picking people up close to where their vehicles are parked. So we have all of those things in place. But still, we have to understand that if you don't feel safe, you feel free to stay home, and there's no penalty for that. We'll get you a spot as soon as we can.
And speaking of the cold weather, that's a great transition to talk to worry a little bit. So like we know, the temperatures are going to be very cold. And I know the county has been having several conversations this week about what resources are available for people who need help. If you could talk us through some of those resources.
Sure. Thank you, Jody. Yes, and as you've mentioned, and Dr. Ariola, we are experiencing those bitter cold temperatures. And if you've been following the National Weather Service prediction, you'll know those aren't easing up anytime soon. The National Weather Service is actually predicting bitter cold throughout this weekend. Minimum wind chills ranging between -10 and -20 degrees Fahrenheit across the region. So again, bitter cold weather will be facing us. When winter temperatures drop significantly like this, below normal, we know that staying warm and safe can be a challenge for some of our residents. So we want to share some information this afternoon about resources available here in Johnson County. Let me start with warming centers. There are 2 available at this time in Johnson County. The first is at the Salvation Army here in Olathe, Kansas at 420 West Santa Fe. And I see on the screen, let me back up. Jody's got the Miriam location, so let me start there. The Miriam Community Center is available. That's okay. There we go.
Want to start with Salvation Army? There you go. Okay.
Let's start with Salvation Army.
Okay.
Thank you, Jody. So the first one, the south part of the county, as I said, is here in Olathe at 420 West Santa Fe Avenue. Telephone number is on the screen there, 780-3640. And we're showing the hours available too. Monday through Friday, 10 a.m. to 4:30 p.m. Unfortunately, they are closed on Saturday, but open on Sunday from 10 to 1 p.m. Would note capacity is limited to approximately 8 to 10. However, they do have food available at that warming center. Second one then, in the north part of the county, is located at the Miriam Community Center at 6040 Slater Street in Miriam. Telephone number 322-5550. Their hours, Monday through Thursday, 5 a.m. to 9 p.m., so well into the evening. Friday, 5 a.m. to 8 p.m., Saturday, 8 a.m. to 6 p.m., and Sunday, 10 to 6. We have provided a link to their website there for additional information. I would note that capacity is limited there to 20 to 25 in their lobby and art gallery. They do require masks, of course, and social distancing are required. They do no pets or animals are allowed at that location. Turning to the need for overnight shelter in Johnson County, we have the homeless shelter at Project 1020 at 9400 Flum Road in Lenexa. Telephone number 219-3347. Hours of operation are 7 p.m. to 7 a.m. until the end of next month, March 31st. Their website is there for your use as well. Next, I want to turn to warming bus information. There is a warming bus that will be available at our Mission Transit Center located at 5251 Johnson Drive. Hours of operation are 6:30 a.m. to 10:30 a.m. and then 3:30 p.m. to 6 p.m. That warming bus is available anytime temperature is 10 degrees Fahrenheit or lower. I do want to note that may seem like some unusual hours of operation. The reason for no midday time is that service at the Mission Transit Center is no buses are running there through the midday. So thus we have nothing available during the midday time. A couple of other resources I did want to note, as many of you may be aware, because of COVID-19, typically our Johnson County libraries serve as warming centers. They are not, again, because of the pandemic. However, they would welcome guests there at any of those locations to use a computer or browse for materials. Computer sessions are currently limited to 70 minutes, but they can be renewed if there's no one waiting multiple times, so that could be an option for you. Hours vary by location. The website is available there to look at a specific location and find those hours. Their telephone number for general information is 826-4600. And then finally, 2 other resources that may provide some relief for individuals are the KC Metro Homeless Hotline at 816-474-4599. And then individuals with a mental health crisis who may be looking for some assistance are also free to call 913-268-0156.
Thanks, Maury. That was some really good information to share. And we will be sharing this information with our media partners, and we'll have this up on our website later today. I just thought we've got an audience here that could benefit from hearing this. So thank you for sharing that information.
You're welcome.
Dr. Ariel, I didn't know if you had anything else you wanted to add, or if you would like to start taking some questions that we have.
I'm happy to take questions.
Okay.
Yeah.
Okay. So we have a couple of health-related questions regarding doses. So someone is asking, should I have someone drive me to my second dose appointment? I think they're curious as to the reaction, the health reaction that they can expect, and will they be able to drive themselves home after getting that second dose?
Oh, absolutely. You can drive yourself. Most of the symptoms that we've seen has been pain at the site of injection, mild fever, and chills, typically occurring later at night or the following day. So, but again, if you would rather somebody drive you, that's okay too. But there's nothing in the reactions to the vaccine that will stop you from driving afterwards. Of course, the 15-minute time after the injection that you sit and you are observed, that you should take advantage of that too. But there really is nothing in the reactions or symptoms post vaccination that should not allow you to drive.
Okay, thank you. And then another one, somebody is Rh negative and they want to know, is there a specific vaccine they should get between Pfizer and Moderna?
I don't know that there's any need to discriminate between either of those options. Again, if you have questions that are very specific, it's always helpful for you to consult with your primary care physician, but there's no contraindication on receiving those things related to that.
Okay, thank you. Someone's asking, are restaurant owners, or I'm sorry, restaurant workers eligible for vaccination? So maybe talk through kind of when different professions can expect to be vaccinated.
Yeah, so grocery store workers, restaurant workers, and congregate settings are eligible in phase 2. They're not currently eligible now because we prioritize within that phase. Right now, our focus is on our residents that are 65 or older, that are our educators, K through 12, as well as our childcare providers. Now, when we are done or close to being done with that group, we'll begin to expand to the rest of those in the phase.
Okay, thank you. A couple questions about the 65 plus group. When will your department, JCDHG, have its own clinics for people in the 65 plus, as opposed to the healthcare systems?
Yeah, we have been having clinics for those 65 plus. We chose, of course, to focus on a subset of the 65 plus, which is 80 plus. And again, I do want to reiterate the need to look at this from the angle of that we're operating from the same pool. And perhaps there are models out there where everything is run through the Department of Health's clinics, and we are a very large county, and that's not very feasible. So every week that people get their shots from Olathe Health, from Advent Health, from KU Med, from Menora, Overland Park Regional, they should, and St. Luke's, they should look at it as all of us operating together. And so that's going on. Every single one of those that are listed have vaccines this week, albeit in small quantities. And they are, again, reaching out to the next 1,000, to the next 2,000 that we couldn't reach last week. And so collectively between them and us, in the next few days, we should knock off another 6,000-7,000 persons in that category. And that's the way to look at it, that collectively is the pool. Now, next week, we have slightly over 7,000 persons needing their second dose. That's going to be our primary focus. And the next few weeks after that, we still expect to focus more on the 80 plus group that we are working in as much as we can. And so if the question is, when are we going to be done with the 80 plus and join the rest of our health systems to move down to 65 plus? I would, if I'm estimating based on the number of doses that we're getting, I would say in a couple of weeks.
Good. We had a question from, one more healthcare related question. So you said that the healthcare systems are reaching out for appointments. And we had a question, are they reaching out to only their patients or are they reaching out to other people? And I guess that depends on the healthcare system. Is that correct?
That is correct. But quite a few of them right now have the option for those who are not their patients to indicate interest in being vaccinated. But we're all in the same pool. We have 95,000 persons 65 plus in our county that we need to vaccinate. We have done some of them through long-term care facilities. We are doing some of them through our independent living arrangements. We are doing some of them through our health systems. We're doing some of them through our Department of Health and Environment clinics. And so, and some of the health systems are doing some of that through their own patients. Olathe has about 15,000 persons on their list. That's their patient. That's 65 plus. I believe Advent said they have over 50,000 people in that pool. Across the region, KU Med has over 90,000 persons, a huge percentage of which are Johnson County residents. So as they are reaching out to those pools, we are all vaccinating and just really reducing the number of persons in that group that needs vaccination. And every week, again, based on what is being distributed between us and them, in that group, every week we are reducing the number of people that need vaccination by about 7,000 every week, and that's huge.
We had a question from someone that works as an emergency responder. So that person is in phase 1 and they're asking, when can I get a vaccine? So what's the best advice for someone that's in phase 1? I know that they can still get vaccinated now and you've already been doing so. So what kind of information do you have for that person?
Right. Every time that we open up our clinics, it's always for 80 plus and those healthcare workers that remain from phase 1. So when we open up our clinics, book a spot and you can come in and get vaccinated.
Would it be better for them to maybe email or call, or is there still a website that they could make an appointment with? What would you suggest the best way for them to do it is?
Yeah, the best way to do that is to wait for us to open up an appointment. Now, if you want to call and or email us jcdhe@jocogov.org, that's fine too, because we're not getting a lot of healthcare workers anymore. They are trickling in. So of course you can always call us also on 715-2819. So if that works for you, and to ensure that we reach out to you when the appointments are available, please go ahead and do that.
Great, thank you. We have a question asking for an update on providing vaccinations for people who live in an independent living facility. What is the latest there?
Yes, so we finalized those agreements a couple of days ago. Really, we've worked on that for several weeks, and one of the things that I'm pretty happy that we got done this week is we reached out to every one of them and got an idea of how many persons needs to be vaccinated. We worked with our partners, Hy-Vee, Urban Pharmacy, who agreed to take that on. Again, that's why, again, I continue to emphasize that if everything is flowing through the Department of Health and Environment, it will be very slow. But that's really an example of how the partnership should work. And so they are starting to schedule appointments. I know that Greenwood Terrace, for example, is scheduled for 17th next week. And so they're being scheduled, and the vaccination is about to start next week. And that's why, again, 2 clinics by us it's not quite as good as 20, 30 clinics between us and our partners. And that exemplifies why the approach is the better approach.
And then I know that you had some news today about kind of your new approach on coordinating volunteers. So tell us about that.
Yeah, thank you. That's again been a very good week in regards to logistics and planning and results. In addition to giving second doses to over 7,000 people and working the arrangements with independent living, it's also finalizing their arrangements with Heart to Heart in terms of screening volunteers and really increasing the pool of people that we can call upon. Before the Facebook Live, I was just on a long meeting with staff, thinking through next week, and really impressed with the number of volunteers that we can pull in. Obviously, we need to train them. Some of them will be able to help right away. Some of them will be able to be trained and observe in sections where once they are trained, they increase our resources and we can call on them to assist. Sometimes to give our staff a break who have been going at this for a year. And sometimes as we open up additional locations and they're comfortable doing the work, we put them, we use their expertise to run our clinic. So pretty exciting week in terms of that agreement with the Heart to Heart, and they do the vetting for those that wants to be to volunteer. So pretty good week in terms of laying the foundation for additional resources moving forward.
And so if somebody has already reached out to your department to say, yes, I'm interested in volunteering, they can expect to hear from Heart to Heart to sort of go start the vetting process and start. Is that something that people can expect as kind of a next step?
Yes, that is accurate. People have been reaching out to us to volunteer, and we have kept their information. And those information really, think about 300 persons were sent to Heart immediately. And so, yeah, people should expect to hear from them. That would be the vetting process. Some of them are nurses and doctors. Others are going to be helpful in the flow of the clinic rather than giving the shots. But we need everyone. We need everyone that's willing to assist. We need people to help with traffic flow. We need people to help with screening and checking. And so, if you've reached out to us before to volunteer, expect to hear from Heart to Heart.
Great. So at the beginning of this call, you had talked about that you did this week, I think you say over 7,000 doses, first and second this week at your multiple clinics.
Yeah.
So I know you had multiple clinics. Sometimes I think you had 2 clinics on the same day.
Yeah.
I guess just in general, what kind of feedback did you get this week, either from your staff or people coming? Are things going smoothly at your clinics?
Overwhelmingly positive response, and candidly, that's the way it's been throughout. The operations are running very smoothly. Again, today the plan was to vaccinate 1,200 people at Arts and Heritage. We ended up doing 1,760 because we keep trying to fit in as many people as we can, and so staff worked virtually non-stop throughout the clinic and just trying to do their best. And yesterday we had clinics both at Oakland Fieldhouse and at Arts and Heritage, and that was the same thing on Wednesday. Really working well, other than maybe Tuesday and part of Wednesday when all of our appointments were not taken up. Again, understand the cold, the weather, and people may be working during the day. But again, my appeal is as we open up those opportunities and we commit resources to those clinics, it helps to fully maximize the opportunities that those clinics present. So, but pretty overall, 1,760 shots today. At the second clinic yesterday, over 1,000 shots. The other clinic over 1,200 shots. That's quite all the things that we set out to achieve this week. We achieved them, and hopefully we do the same thing next week.
Well, I think that is that's a great place to wrap up our vaccination information. I know that Maury Thompson has an update for us. So let's hear what he has to say.
Thanks, Jody. I just wanted to share a bit of information I received while we were visiting over the last few minutes. The Salvation Army wanted to note that their warming center will not be open this coming Monday due to President's Day. That's a holiday that they observe, so that won't be available. And then finally, I'd just like to say thank you to the Salvation Army, the City of Merriam, and Project 1020 for the assistance that they're providing to our residents who need help getting in out of these elements. So again, a big thank you to those community partners for the service they provide.
Well, that's great information. And again, we will make sure that all of that cold weather information makes it on our website so people know how to access that. Maury Thompson, thank you so much for joining us today. That was nice to have you on as a special guest. Dr. Ariola, thank you for all the information you provided this week. Thanks to Brett. I forgot to mention you at the beginning for today's ASL interpreter. We really appreciate you being here and the team of people behind the scenes that you don't see that help make these possible every day. And then thanks to those of you who are watching on Facebook, giving your comments, asking questions. We really appreciate the engagement and we wish you to all have a great weekend. Thanks very much.